Right now, somewhere in your city, there is a room designed entirely around the problem of a hurting tooth. It has a padded chair calibrated to recline at the exact angle that keeps you relaxed. It has tools sterilized to surgical precision, laid out on a tray in the exact order they will be needed. And it has a syringe loaded with a compound that will make you feel absolutely nothing for the next 2 hours. You sit down. You open your mouth. And within 60 seconds, an entire side of your face disappears from sensation. When it's over, you leave with a toothbrush, a small sticker, and the vague sense that the whole thing wasn't so bad. In the modern world, a toothache is an inconvenience. It is a Tuesday problem. Now step back. Not decades. Not centuries. Tens of thousands of years. The tooth still hurts. The infection still builds. The nerve still fires. But there is no chair. There is no needle. There is no one with a white coat and a tray of sterile instruments. There is just you, the pain, and the wilderness pressing in from every direction. For hundreds of thousands of years, that was the only reality. So what did people actually do? To understand what ancient people were actually dealing with, you need to understand what a toothache truly is, because most people don't. A tooth is a living structure. At its core is the pulp, soft tissue packed with blood vessels and nerve endings that connect directly to your brain. When bacteria breach the enamel and reach the pulp, something changes. The pain is no longer a warning. It becomes a presence. It pulses with your heartbeat. It radiates into your jaw, behind your eye socket, deep into your ear canal. It wakes you at 3 in the morning. It makes food impossible. It makes thought difficult. And if nothing is done, the infection does not stay in the tooth. It migrates into the jawbone, into the soft tissue of the neck. In the most severe cases, toward the brain. Archaeologists have recovered skulls thousands of years old where the jawbone itself has been partially consumed by abscess. These were not rare cases. Studies of ancient skeletal populations show the majority of adults had significant dental pathology. A rotting tooth was not a dental problem. It was a survival problem. So what did they reach for? The answer, across almost every culture on Earth, was the same: the natural world around them. Cloves were among the most effective. They contain eugenol, a naturally occurring compound that produces genuine topical anesthesia on contact with tissue. People pressed them directly against the decayed tissue. The relief was partial, but it was real. There was genuine chemistry behind it. Willow bark was another. The inner bark of the salix tree contains salicin, the compound that would eventually, thousands of years later, be refined into aspirin. It reduced fever. It reduced inflammation. It did not fix the tooth, but it kept the body from feeling quite so certain it was dying. Garlic was applied directly to infected gum tissue. It has documented antimicrobial properties, meaning it genuinely kills some of the bacteria responsible for the infection. Across different cultures, mud poultices were pressed against swollen cheeks to draw heat. Animal fat was worked into gum tissue. In some traditions, burning herbs were used to direct medicated smoke directly into the oral cavity, an early form of fumigation therapy. Some of these remedies had real pharmacological basis. Some were entirely ineffective, but none of them addressed the core problem. The infection didn't negotiate. It didn't respond to good intentions. It continued its work, deeper, without pause, which meant that eventually someone had to go in. In 2006, an archaeological team excavating a Neolithic site in what is now Pakistan made a discovery that fundamentally changed our understanding of human history. They found teeth. Specifically, they found molars containing small, precisely drilled holes. Not the ragged, irregular pitting of decay. Clean, cone-shaped boreholes. Up to 3.5 millimeters deep. Deliberate. Precise. Intentional. These teeth date to approximately 9,000 years ago, before pottery was widespread, before writing existed in any form, before the wheel. The tool they used was a bow drill, a fire-starting instrument adapted for surgical application, operated by hand, powered by the friction of sinew cord on wood, and pressed into a living tooth in a living person with no anesthesia of any kind. Think about what that means. Someone designed a medical procedure, trained to perform it, and persuaded other people to voluntarily submit to it. That is not instinct. That is not accident. That is the beginning of medicine. And the patients survived. The evidence is in the wear patterns. These drilled teeth show years of continued use after the procedure. Someone sat through a bow drill turning inside their mouth, and then went on with their life. That is the most understated act of endurance in human history. Drilling required skill and access to specific tools. For most people across most of history, when a tooth became unbearable, the solution was blunter. Extraction. The complete removal of the tooth from the socket. Archaeological evidence of deliberate extraction goes back at least 14,000 years, long before any metal tools existed. The early tools were bone splinters, hardwood levers, sharpened antler tines, anything that could grip the crown and apply controlled leverage to the root. By the medieval period, a specialized instrument called the dental pelican had emerged, a lever device designed to crack the tooth from its socket with a single controlled force. The person operating it was often not a doctor. In medieval Europe, it was frequently the barber, whose shop was also the surgery, the pharmacy, and the dental practice. The procedure was exactly what you would imagine. The patient was positioned. The tooth was gripped. And it was worked free by force, rocked, twisted, and pulled until the periodontal ligament gave way. Sometimes the root fractured and remained in the jaw. Sometimes severe hemorrhage followed. Infection was a common complication. And yet, it worked. The source of the infection was gone. The nerve that had been firing for days or weeks finally went silent. For ancient people with no other option, that relief, however brutal the path to it, was everything. Now scale that experience outward. Not one person, entire communities. Studies of ancient skeletal remains from farming communities reveal that the shift to an agricultural diet, high in fermentable carbohydrates, caused an explosion in dental caries. Which means that the moment humans began farming, the moment civilization began, dental pain became a mass phenomenon. Chronic pain of this kind doesn't just hurt. It degrades cognitive function. It compromises sleep architecture. It elevates cortisol levels and suppresses immune response. A community where a significant portion of adults are operating under chronic pain is a measurably less effective community. Decisions made more slowly. Hunts executed with less precision. Winters survived with less margin. Dental pain was not a side story in ancient human history. It was woven into the fabric of survival itself. Here is what is remarkable about all of this. At no point did ancient people simply accept the pain and do nothing. They observed. They experimented. They recorded what worked in the most durable format available to them. Oral tradition, passed between generations for thousands of years. The healer who drilled teeth in Murgar was working from a foundation of accumulated knowledge. Someone before them had observed. Someone before that had tried something. The chain goes back further than we can see. The eugenol in the clove that an ancient healer pressed against infected tissue is the same compound that dentists used in professional practice until well into the 20th century. The flint borehole in a Neolithic molar and the preparation cavity drilled by a modern endodontist operate on the same mechanical principle, remove the infected material to stop the infection's progression. Every piece of dental knowledge we have today traces backward through an unbroken chain of human suffering, observation, and ingenuity. Built not in universities, not in laboratories, but around fires, in caves, in pain, by people who refused to stop trying. So, the next time you sit in that padded chair, under that warm light, and feel that needle go into your gum, and the sensation of numbness spreads across the side of your face within 60 seconds. Remember that someone earned this for you. Not a doctor with a degree. Not a corporation with a patent. A person, sitting in the dark, in pain, who decided to try something. That is where your dentist chair came from. And honestly, that is not a small thing.